A newly refined cosmetic procedure is allowing patients to benefit from something they're glad to get rid of, fat from their own bodies. Now surgeons are able to transfer it to the face with the promise of filling in wrinkles with longer lasting results. Debbie, who asked us not to use her last name, says she's always had plenty of energy for work and exercise, but apparently that isn't the way it's looked to everyone.
Well, I was constantly being told that I look tired, and no matter how much sleep you get, if you're continually being told that you're tired, you want to try to figure out a way to deal with it.
Hi, Debbie.
What she did was decide on cosmetic work, and specifically an increasingly popular technique used to augment her cheekbones and eye area.
The volume for the fat, which is in here and in there, has stayed very nicely.
Dr. Randall Weil says the technique known as fat transfer has advantages over artificial fillers, which stay in the body temporarily.
The techniques have evolved such that the way the fat is placed, the way the fat is harvested, that we're able to have more of the fat stay.
First, the fat is collected from the patient's stomach.
There is almost no one who does not have enough fat for a fat transfer.
Then a technician separates the fat cells. Dr. Weil says a key is reducing the fat into smaller and smaller syringes because newer strategies require placing it into multiple targeted areas around the face where it's most likely to be integrated into the body.
The fat actually becomes what we say vascularized, so your own blood vessels will grow into the fat and it will become part of you again in a new spot.
Over the next hour, Dr. Weil makes a series of injections, building layers of fat along the natural scaffolding of the patient's tissue. He says the fat transfer can also be used to augment lips or fill smile lines. Still, he says it can take several months to learn what the permanent effects will be.
I'd say conservative figures, usually 30 to 40% of the fat will stay.
Debbie says the fat injections combined with a separate procedure to smooth her jawline gave her the rejuvenated look she was hoping for.
I think that the way I look fits the way or the lifestyle that I have.
And since the fat comes from the patient's own body, Dr. Weil says there is little chance of rejection. A typical facial procedure runs between $2,500 to $3,500 and is most often not covered by insurance.